Exactly. Okay. So, welcome back to everybody coming back. This is our second podcast. And today we're talking with Katie about trauma, its effects on the body, and how it affects people differently because not everybody suffers in the same way. So, tell us a little bit about trauma, Katie, and how that manifests in the body.
Such a big subject, though, and it's a really big buzzword at the moment, right? It's
Hmm.
everywhere.
Yes.
Everyone's talking about trauma, shadow work, healing journeys, all of
Hmm.
those things. And it's just a really big thing for people to go through right now. So, what is trauma is the big question, isn't it?
Mm.
Um, and it's so different for everybody. I mean, especially if you may have neurodivergence, you can have really big reactions to trauma that someone who is neurotypical might not have. Something that you experience that happened once could be a profound impact on your life, whereas I might experience it in a very different way, and it's not the same.
Hmm.
Um, so yeah, it really is what affects you in a long-term damaging way. And when I say long-term, I mean after the event. So it's just something that negatively impacts you in whatever way that looks like for you. And there is a set of symptoms and descriptions of trauma, which we'll get into, that are generally the same, but everyone experiences trauma so differently.
So I think let's take an example. For instance, I've got two examples in my life. One is obviously childhood trauma, so that's
Hmm.
caused by someone else, or the experiences that I've had with someone else, not necessarily caused by them, but the experiences I've had
Yeah.
with them. And then I have the issue of my motorcycle accident, which has stopped me riding motorbikes and stopped me actually
Wow.
enjoying being in a car. So I can't even be in the car at the moment and have a mild or a minor thing happen on the road without completely freaking out, losing my mind, and wanting to dive out of the car and hide in a corner
Yeah.
somewhere. So um, maybe you can explain if there's any differences between the two, or would one trauma make you behave in a different way to a different kind of trauma, or are the symptoms of what we suffer the same for different people? Do you see what I mean?
I do. That's a big topic. So it really depends, and I'll answer this in two parts. So I mean, a lot of people don't really necessarily understand what trauma is, first of all. So we can go
Hmm.
through our life thinking that we haven't been through any trauma, and so many people come to me saying, my life was great. I haven't had anything. I've just had this one thing I want to work on, and we'll work on that. And then when we start looking at it, it's a huge picture of a really long-term thing. So trauma can be witnessing or experiencing stuff yourself or through other people, first of all. So it doesn't necessarily need to happen to you. It can happen to other people and cause you trauma.
Good point.
It
Yeah.
can be anything. It can be anything from like violence, serious accidents, so seeing that or being in one, abuse, assault, neglect, natural disasters, terrorism, war, somebody dying, or seeing somebody dying, or being in a job that is those types of things as well, and serious illness too. So all of these things are, they're the big kind of traumas that we can go through. But again, all of those things drop down to lots of different things as well, and different things within our families, and just well, that family dynamics can cause trauma. So having the types of toxic families, narcissistic parents, those kinds of things, it's all trauma, and it's different for everyone.
Mm, mm.
And then the second part of your question was, how does that look? Does it play out the same way with certain people? And it really depends on what happened, how many times, how long for, and how complex the issue was. So I know you've been through a lot of trauma, and have you had kind of diagnoses with regard to like what types of um, medical conditions you have because of that, like PTSD, things like that?
So, I've been very naughty and not really looked after myself over the years, and I've managed everything myself. And I think I've not really spoken to people about what's been going on in my life, and therefore no
Yeah,
diagnosis until I got older. It wasn't till I hit 52 that I started looking into a diagnosis of ADHD, because I think that has some bearing
yeah,
on the trauma that I've
really does. Yeah.
managed. But I also think that for me personally, I've hidden it. I've hidden all my trauma, I've hidden all my emotions. I've driven them down so far, so deep into my boots, that no one realized that I was suffering, even myself, that I was suffering with those problems. I was using those coping mechanisms, is probably the way I
Hmm.
would word it, rather than suffering, because
Yeah.
I've hidden it so far I didn't realize I had a problem. And it wasn't till I started digging through it with you, as we know, that I'm starting to remember things. And so, yeah, I haven't got any diagnosis by any clinical people apart
Yeah.
from recently, which I've got the NHS on board, and they're now suggesting that I have CPTSD, which is complex post traumatic
Yeah.
stress disorder, or whatever they
Yeah.
call it, which I think you kind of agreed with me when we started talking.
And that's a similar story for a lot of people. They go through their life holding this stuff, and it's not actively them choosing to hold it. It's, it's stuff that we don't realize is there, or that we think we're okay. And we go through our life and we don't get this stuff diagnosed, and we don't really talk about it until something happens. And again,
Mm,
we'll get onto that later. But yeah, for me, I have a diagnosis of CPTSD as well. And it wasn't until I hit the kind of proverbial wall and
mm,
started going to see a trauma specialist that did I even realize what had happened to me too. And it then took like loads of research for me to understand how much this stuff had impacted me. And it's not until, like you've just said, you started looking at this stuff, did you realize that how deeply and how across the board it had affected you in your life?
yeah, do you know one of the funnily enough, as you were talking, I think one of the biggest things that I realized this week is my realization for this actually, is that
Mm,
that whether people realize it or not, and probably my friends would go, "Really? I never knew you would that was going on underneath," because they
mm,
see me as this calm together, well put together person. But one of the
yes,
biggest things that I realized is I was carrying so much anger about everything I've been through that when I finally let it go this week, I feel like a totally different person. I do.
that.
I feel like someone has thrown a load of candy floss under me and I'm bouncing around in this soft, beautiful cloudiness that's just never been there before. So for 50 odd years, I didn't realize I had this problem because it's so deeply embedded. And I think a lot of
Yeah.
people just, they, like you say, they don't realize that they're suffering these things or that this stuff's going on because the knee jerk reaction to things going on around you is exactly that knee jerk in a protective fashion rather than
And deal with it.
necessary. Yeah.
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 So,
I and that's it's so similar for so many people. They go through life thinking that they're okay and that they're just trying to cope with all of the things that are coming their way, and they don't have time or space to be able to look at all the things that they went through.
mm,
And most likely, they're getting told like, oh, stop living in the past, stop talking about it, stop doing this, stop doing that. And that's normally the people that did it to them in the first place.
mm,
But we're all told that stop going back to the past, stop living in that past, you're dwelling on it.
mm.
No, your body's telling you need to deal with it.
I think this is the biggest issue that, or not an issue, but it's one of, and again, another recognition is that we do have to talk about it, but it needs to be in a
Mhm.
way that you can release it. You don't want to keep talking about it over and over and over and not getting any further
Yeah,
forward because all you're doing is reliving the event without a solution, right?
such a good point. And so many people come to me, especially PTSD clients and neurodivergent clients, that when like normal kind of therapy for people that have experienced complex trauma or lots of different traumas, even just single traumas, talking about it over and over again, or going through all those memories, going through all the details, just re-traumatizes them, and they can't put it anywhere, they can't
No.
channel it anywhere.
Hmm.
And they're certainly not releasing those emotions as such, because a lot of the time they get told to kind of, oh, dampen that back down because we don't want you to get too overwhelmed or going to a panic attack. But the thing is, if that's managed correctly and you know how to manage that and what to do and thematically help your body deal with this stuff,
Hmm.
then it can be channeled and it can be released through your body, and that's the whole point of the process.
I think one of my most important sessions with you was probably the last one where I had a full on meltdown cry with sobbing and weird sounds and body
And
shaking
what did I
and
tell you? What did I tell you?
I let it happen, just to
Yeah,
let it
stop
happen.
talking, let your brain connect to your body,
Mhm.
feel that emotion, and your body literally, you're probably one of the most amazing people I've had in, because a lot of people it takes them to do a full kind of trauma release session with me, but for you do it quite naturally, and your whole body shakes, all of your muscles get involved in everything, and you can just see that your body is really releasing the stuff and burning through it all
Mm.
and completing that cycle, and it's beautiful to watch.
Oh,
And
bless you.
it
Thank you.
doesn't overwhelm you, and it doesn't, but you're just releasing it. And then afterwards you're like, oh my God, where did that come from? And
Yeah.
then you're you're good.
Yeah, I think it's something I've probably done naturally a lot, and it's probably why I've survived
Mm,
so long.
yeah.
Because I tend to, when I get to a limit, even to the point of probably a scary, angry release where I'll just lose my mind at some point. But I do think allowing your body to do that with a punch bag, or going
Mhm.
running for 30 minutes, or screaming into a jumper as you had me do one day, or I actually think it's a really successful way of doing it. It certainly works for me, and not something that I knew about before or allowed myself the space to do. So, and I think
Yeah,
sometimes we need people like you, um, therapy, soul guidance, therapy for some, soul guidance for me, to show us the way. I do.
yeah.
Mm,
And it's something we're not taught. We're taught about all of the psychological impacts of trauma, or, anxiety, depression, all of those things, suicidal thoughts, all of that. We're not taught about how our body stores this stuff and how we are supposed to process that, what we're even supposed to do. And that's such a big mountain for people to climb. And
mm,
they're like, well, what do I do if I've processed it in my brain? There's just so many different facets of it, and how to go through it, and
mm.
how to start treating it.
So, in your experience, what would you say are the outward signs of trauma in people? How does that present itself? I mean, for me, it's angry
Mm,
outbursts. I think because
yeah.
I've had angry outbursts all my life, and I've had, on occasion, the inability to manage my emotions,
Yeah.
and they come out in
Um,
anger.
well, generally, firstly, there's three different general descriptions of trauma. So you have like acute trauma, which is like a single highly stressful event. So it's one thing that happened to you or you witnessed that has
Mm,
caused you an impact, a detrimental impact. Then there's chronic trauma, which is an ongoing, repeated traumatic event. So that could be kind of physical abuse, sexual abuse, emotional abuse, like domestic violence, poverty, those kinds of things.
okay.
And that leads to something called toxic stress, which we'll talk about a little bit later. And then there's your PTSDs, your medical effects, your long term issues of this stuff. Um, and so that can appear immediately or not until years after the event. So this is where it starts to get different for different people, dependent on the trauma that you've experienced.
Hmm.
And so then the last type is complex trauma. So that is where we get into the realms of complex PTSD. So it's a type of stress that's similar to generational trauma. And it's where someone experiences like multiple chronic or prolonged exposure of complex trauma. So this is where we get into our family units with different kinds of, abuse, abandonment, those kinds of things, domestic violence, lots of different things. But it is something that's over a long period of time. So that's chronic, but then it's also very complex in the different types of things you've experienced.
So,
And that's, go on.
sorry. So, sorry. Just wanted to ask you. So, if you have multiple types of trauma over
Hmm.
multiple years, that would equate
Yeah,
to complex
yes.
PTSD, right?
And so the difference is that chronic trauma is something like, physical abuse, which is the same type of trauma, but over a long period of time. But then
Right.
complex trauma would be physical abuse. And then, for example, whatever, I don't know, like you experienced some sort of war torn culture thing, like, so there's
So
different
multiple,
types of
yeah,
things.
multiple different types.
Yeah,
So, for instance, for me,
yeah.
alongside the childhood trauma, there's the motorcycle
Hmm.
accident, there's the neglect. So there's, yeah,
Yeah,
multiple different things. Okay.
yes. And so that's why you have a diagnosis of complex PTSD, and so do I.
Mm.
Um, and that can also lead to toxic stress, which again we will talk about later, and real medical effects, real long-term issues. And again, this one can appear immediately or years after, or it's so complex and so big and vast sometimes that it is really different for everybody and how they experience it.
So that's a very good point. And for those of you that are watching today, Katie does offer a personal service in trauma therapy and soul guidance, as we like to call it. So if you are looking to help yourself, maybe have a look at Katie's website. So, how does trauma present itself, and what are the sort of symptoms you get? Because I know that you explained to me that physical symptoms or physical illnesses can come from
Mm,
stress and trauma. traumatic events, basically.
Absolutely. And again, it's very different for everyone. Everybody's body chooses to respond to trauma in different ways. And so it will look different for everybody, but there will be a general set of symptoms that we will kind of all experience, all those big trauma symptoms. But just to mention for like PTSD and CPTSD and things, there does need to be not a need, there needs to be where you thought that your life was in danger at some point or in some of those traumas for you to have a diagnosis of PTSD. And it's something that we do talk about a lot, PTSD, and it's kind of not thrown around a lot. That's a bit, too much to say, but it is something that people think, oh, do I have that? Do I have this? It's a very serious response to trauma that is very
Mm,
different. So that's a kind of standalone thing. But most of these symptoms, I mean, a lot of people will experience flashbacks, intrusive memories, nightmares, and that is, again, that comes along with kind of PTSD and things like that. But a lot of people that have experienced trauma will experience those things. Avoidance of people, places, things, situations that remind you of that event. So you could
mhm.
isolate, you could stop doing things because you get triggered by those events or those places. Feeling numb, disconnected from others, difficulty concentrating, irritability, hypervigilance is where you're very aware of everything in your surroundings to try and notice the danger. Your brain's looking for danger everywhere because it's
That's
very used
me.
to doing that. If you come from kind of a dangerous upbringing or very difficult upbringing, confusion, exhaustion, agitation, sadness, anxiety. I'm sounding like anyone out there because it sounds like me.
Me,
Um,
me.
Dissociation, and there's different types of dissociation where we can either think that we're not in our body or we're not in reality or we're just not connected in some way. We kind of lose our ability to be present in ourselves. So that can be very confusing, very terrifying at times. And this is where we get to all of these kind of physical symptoms, the chronic pain, the difficulty sleeping, the nerve pain, random things going on in your body, digestion problems, skin problems, eye problems. A lot of people come and ask me about, is alopecia a thing? Absolutely, alopecia is a thing, and that's a shock response for your body. There's so many different things that can happen to your body physically because of the fallout of trauma. And then we get into the kind of emotional side of things with just angry outbursts, feeling that there's this anger under the surface, which I know you've spoken about, and you've felt
Mm,
this internal rage that you can't explain.
mhm.
And again, that depression. And what we can do is we can start to cover up these things, but it is a symptom. It's a coping mechanism, but also a symptom. Things like substance abuse, self-harm, obsessive compulsive disorders, suicidal thoughts, suicidal attempts, believing that the world's a dangerous place and you can't trust anybody, feeling unable to experience like pleasure, joy, happiness. There's just this nothingness.
Yeah.
And
I think, actually you going through all that list, I was like, "Yep, yep,
yep,
yep, yep,
yeah,
yep." Funnily enough, actually, when you say that, the inability to enjoy life is a big one for me because I think what I've
mm,
done over the years is instead of actually enjoying the things that I wanted to, apart from when I was traveling in that was great. But I do think that personally for me, I've hidden my enjoyment because I didn't feel like I should be enjoying myself due to whatever's been
yeah,
going on. And I would
yeah,
keep myself busy with other stuff or looking out for other people or doing things for other people or trying to people please or so recently I've started to realize that I'm entitled to enjoy myself as well. And so are you out there. Make sure you remember to take time for yourself, that we forget that we should be nice to
yeah.
ourselves and do the things that we enjoy. And I think you end up living in this system of protection so much so that you forget to enjoy life in general.
Yeah, and so many people find that that comes with guilt and
Yes.
shame, and that tells me they had someone in their childhood that used to want them to do stuff all the time. Why aren't you doing that? Why aren't you tidying up? Why aren't you doing this?
Mm.
Why aren't you achieving? Why aren't you out there doing? You
Mm.
can't rest. You're a lazy person. Sorry if that's triggered anyone,
No.
but that's where we get that guilt from in adult life, where we sit down and we rest and we think, God, I should be doing something. I should be tidying, and it comes from that again, that generational thing of it's taught to us that the house needs to be tidy, the car needs to be clean, all of these things, the kids
Mm.
need to be clean and tidy and happy and fed, and of course they do, but it doesn't need to be to that extent of that level. of perfection that a lot of us are taught.
Mm. Do you think also sometimes because parents forget to give you the good side of parenting as well? So,
Mm.
for instance, you're being told that needs clearing up, do your homework, here's your dinner, make sure you clear your plate, let's go back, it's bedtime now. But they forget maybe to do the fun side of things, like taking you out to a lake and swimming. Or do you think that sometimes just the lack of the fun stuff can leave people with trauma?
Yes, and that is a sign of generational trauma. So that parent, so that this is what my parents had trouble with, playing with me,
Yes.
interacting with me, getting on the floor and doing that kind of stuff. My dad was really good at reading us stories and doing that, but still there was this lack of joy and play.
Mm,
And that's because they were traumatized. They had that kind of parenting and they weren't played with. They weren't loved and cared for and all of that stuff in those tiny moments where we should have joy.
mm,
And but that is a sign also of hypervigilance too, in that when we're a child and we're sat on the floor and we're playing, somebody comes in and says clean this up, or gets angry, or God forbid gets violent, and so our brain then learns that playing, letting your hair down, being peaceful and joyful is a really unsafe place to be. And so as an adult, sitting down and playing with our kids makes us really uncomfortable, really stressed, really anxious, and we can't say why. We just know that we really don't like it, and it's
mm.
really hard for me to sit on the floor and play with my son. Is awfully hard, and I hate
Oh,
that.
oh, bless you. Yes, I know exactly what you mean. It does get easier, Katie. It does. Do you know the
Yeah,
best thing about having a grandchild is that I am having the most amount of fun diving around in the water in the pool with him. And
yeah,
because I have time now, and I think that's the beauty of being a grandparent is that you stop worrying about parenting your own child and you start to think, I can just
yeah.
have fun here. So, but
I
I do get
wonder,
it. Mm,
as you're talking, like, I wonder whether, we do blame our parents a lot for being like the narcissist and all of that.
mm,
But when we do start to heal that, we start to get this compassionate view of them. And maybe that's what they were going through. And so
yes.
when those parents that were really toxic and really abusive or whatever then become great grandparents, and you're like, why? Why
Yeah.
could you not do that for me?
Yep.
And you're doing it for my kid and you're having a great time and you're brilliant. Why? And
It's
then it makes us really upset.
mm,
But maybe they've lost that I
it's
have to parent correctly and all of that pressure and all of that self-judgment,
mhm.
and they've just let themselves go with their grandchild and
Well, for
maybe
me,
have
if you think about it, I've learnt that a lot of my trauma was affecting the way I was parenting because let's take the
100%.
word trauma out for instance, okay? And let's say, okay, I learnt to parent from my parents who were two
Mm,
broken children. So how the heck can they give me worthwhile information when they weren't given that themselves? So
yeah,
me having to relearn how to parent myself effectively is now how I'm
yeah,
learning to be the best grandma I can be. So,
yeah,
yeah, I think we do need to be a little bit. I mean, it's a bit like my diary insert that I wrote, where we need to be a little bit more forgiving with our parents once we understand where they've been. If they're choosing to be that way without trying to
mm,
change, then no
yeah,
forgiveness. That's their journey to take. But
true. But then maybe we don't give them enough credit either with the fact that we've got access to all of this stuff,
mhm,
podcasts like this, and TikTok and Facebook and Instagram, all of this stuff, all of the internet, everything is out there at our fingertips to
mhm,
learn about this stuff and to find people that are professionals in this area. They
mhm,
didn't have that. All they had was their parents going, "No, let them cry it out. No, don't pick them up. They'll be too this or too that." Like that's all they had, and a
yeah.
couple of books they could get from the library or whatever, and they didn't get this, but they still did this stuff and they still chose to do it and they still chose not to change and try and learn in any way. So
Mhm.
there's both sides to that coin, and it's a difficult balance to have.
The motorbike accident was such a traumatic experience and with some serious physical difficulties afterwards, off being off my foot properly for a year. I can't ride my bike.
Yeah,
I can't be in a car without wanting to.
yeah,
Yeah, my body goes into this kind of
yeah.
when I'm in the car. So
And
yes,
is that what then led you to realizing that you needed to deal with the rest of your trauma?
yes. I think that put me in a position where I needed to look at everything because it all piled on all at once for some
Right.
reason.
It's funny that you should say that because it was a similar thing with me, in that, again, I thought I was perfectly fine until I had my child. My pregnancy was perfect. The day I gave birth, everything, for the want of a better way, went to shit. Like it
Oh.
just went, like it felt like, and I remember ringing my stepmother and being like, I'm supposed to be getting better and I'm not, and why? And she had no answer and just a lot of critical sayings. But
Mhm.
again, now I know that, and a lot of people start dealing with their trauma because they've had something big happen in their life, whether it be the birth of a child, like a virus or a big infection, or an accident, like physical trauma that's happened to them, or a serious illness where their body then goes, this is too much for me to take. And I've
Mm,
been holding all of this stuff and you didn't know about it. And now all of that needs to come out because I can't do it anymore. And it gets so overwhelmed that everything just starts to shut down and everything starts falling apart. And that's what it feels like. What you said, it just starts to feel like everything started to pile on top of you and you needed to start processing this stuff.
absolutely. I think for me, I felt like an overfilled bucket where everything was just flowing out of the top,
Yeah.
and I couldn't stop it coming out. And then I was behaving erratically, actually. So I had no control over my anger anymore. I was irritable every day. I was talking to, despite the issues I have with my mum. She doesn't deserve for me to talk to her in an irritable fashion, but I couldn't control it. It was everything became a problem. I didn't want to eat. I did want to overeat. I couldn't go out in the car, and so yeah, I think we get overloaded and it just starts to fall out of the top with nowhere to go.
Yeah.
For
And
sure.
that's because your body, and we'll talk probably about this a bit later about fight, flight, freeze, and fawn. But it's because you've been living in a fight or flight response your whole life.
Mm,
And then you've had this huge thing happen, literally, and your body just goes, I'm done. I can't, I physically can't take any of this anymore.
no.
And everything starts to just fall into this giant snowball.
I actually think that a lot of people, I mean, there's probably a lot of people out there like me where I think what happened for me is this accident was so out of my control because it came from behind and I wasn't expecting it. I think I had most of my life has been so controlled to keep me safe because I'm in a
Yeah.
fighting mode. So I have to plan to make sure that I'm going to be safe. I think this issue was what pushed me over the edge because I had no
Yeah.
control and I had no
Yeah.
way to control the fallout. And I think that just, started raining down on me like meteors or something. And I had nowhere to
Yeah.
go, nowhere to hide.
So did you feel like your psychological stuff was changing? Like were you getting more anxiety? Did you get depressed? Like what happened psychologically for you?
So over my life, depression's been a thing on and off, which I
Mm,
managed with. I think actually I've got quite a strong mind, if I'm completely honest, because I
mm,
managed that generally, sometimes with medication from the doctors and trying to get myself therapy, which I never felt worked for me because they run through this static think system of National Health Service options, which doesn't work for me, probably because I'm neurodivergent.
yeah,
But what I did start to realize is that I was having symptoms of anxiety, which I didn't know what they were. I was having these moments of this palpitation feeling in my chest, like where my heart
yeah,
was beating through my chest. And I didn't know that that's what it was because I'd never experienced it. And it
yeah.
wasn't until I started talking to Carlos about it, he said, "That's what I get when I get anxious." And I'm like, "But I'm not an anxious person. What's going on? Why can't I control this feeling in my chest?" And even talking about it, actually, I can feel it rising. So it's just a
Mm.
dreadful thing to experience where you've got no control over this heart racing. I can't cope with this kind of feeling. And I think that's probably what made me realize there's something really, I won't say bad, but there was something very different going on in my body that I couldn't cope with, or that my body couldn't cope with.
And that actually leads really nicely into the next point that I was going to make. So I wanted to ask you a few questions about that because it's really
Mm.
interesting. So that anxiety, like if you can name that feeling that was underneath it, was it a fear of something happening? Was
Terror,
it, what was it?
an
Terror
utter
about
terror.
what?
I don't know. This is the thing. It came up with no. For me, I had no connection. It was just this feeling in my body that was rising. So I personally, I also suffer with nausea. So
Mhm.
I'm beginning to see the triggers with that. Specifically for me, if my mum rolls her eyes at me,
Mm.
it sets off nausea.
Mhm.
And I know that there's a connection with your body. And obviously, you say the digestive system shuts down with anxiety or stress, or it can
That's
do.
such a good point. But every time your mother rolls her, we could let's do this in real time. This is a really good
Okay.
exercise.
Yeah.
So every time your mother rolls her eyes, what did that mean to you in childhood when she did that? What would she do after that?
That she doesn't believe me, that you're not important. What you're saying is not important.
Yeah. So
Mm.
is it fair to say, I don't want to put words in your mouth, is it fair to say she would be abusive in some way? She would be critical, she would.
I think actually, generally, what came after that was her ignoring me, ignoring what I was
There we
saying.
are. Okay. So that and a lot of people as well, you're coming up with some amazing points that I just want to talk about forever. And so that ignoring is a giant form of abuse, and people don't realize that
Mm,
that cutting off a child is emotionally neglecting. It's emotionally abusive to that child. To really to do that is awful, and it's an
mm.
awful experience for a child. So now as an adult, every time your mother rolls her eyes, you have a release of adrenaline because your brain learned every time she rolls her eyes, she's going to ignore me and she's going to shut me out. And I'm going to be on my own and all the way down the rabbit hole to
And this is
all of those
important for
feelings.
me. Yeah, because in my mind, what's happening is something important for me because I need to converse about this and have a conversation and find a way out or a solution. And I'm not being
Hmm.
given that by the person who is supposed to give me everything,
Yes.
right?
And that is where, as a child, when you've had that response, so every time you say something or you try and tell the truth or you try and talk, speak up, whatever it is, or just be normal and be a child and talk to her, and she rolls her eyes, completely dismisses you, what's going to come next is that ignoring and that shutting out and that shutting down of emotions and completely dismissing you as a child.
Mm.
So, what core belief did that form for you as a child about yourself?
So for me, and and people are going to go, but you're doing a podcast. What are you talking about? For me,
Currently
actually,
healing her childhood trauma.
yes, exactly. Healing my childhood trauma by actually putting myself out there. So for me, my belief is that I'm not important enough to share my information with,
There,
that
there.
people are not going to believe me, that people are going to go, "Ugh, what does she know? She has no idea. Like, she doesn't know what she's
Hmm.
talking about. She's got no qualifications." When actually I have good qualifications in surviving trauma and family life and depression and anxiety. And so, yeah, it left me feeling like I am worthless actually. That what's the point? I have no
Really well
value.
done.
Mm.
Yeah,
So yeah, but I know that you can change those thoughts
we
about yourself.
absolutely can. And that's how, by that beautiful example you've just given, is how core beliefs are formed in childhood. And what will happen is that we will then carry those into our adult life and they start to play out in different ways. So if your boss were to roll his eyes at you, you would have that same response. You would have that same fallout and all of those
Mm.
emotions come up.
Hmm.
And you don't want that to happen at work. So, but that's how it plays out. And then we go into this anxiety spiral of, I'm not important, I'm not worthy, everyone hates me, whatever it is. And all of those really core beliefs kind of all come down to a self-worth issue, a worthlessness feeling in some way. It's just different. It's got a different face on it.
I have a really good example from a work situation that I think you'll be able to do something with. So I was working quite in a quite well-known estate agency for a number of years, quite successful, and I had this experience of my managing director requested my presence at a meeting at the head
Mhm.
office. On the way there, I got stuck in traffic, and this is the second time I had an issue getting there. Right, completely out of my control. So his response was to call me and say, "Don't bother coming, turn around and go back," with this attitude, "Don't bother coming. If you can't get here on time, we don't want you here," etc., etc.
Wow.
Yes. Next time, be on time. And I said, well, look, I'm stuck in traffic. Like, there's an accident. I can't get there. That's not the point. You should have left earlier. But I left 45 minutes more than I should need to travel there. I think that's plenty. I can't get there. There's traffic.
Yeah.
Anyway, you get the scenario. So obviously I didn't go. It made me feel like a naughty school child. And from that point forward, I had issues at work. So
Wow.
we used to do what were called ring outs, and anybody working for the company that I worked at will know exactly what I mean, and they'll all be going, "Ugh." Um, but basically, these were sessions where you had to go and ring old client and stuff like that. I couldn't do those after that point. I couldn't go,
Wow.
and the second one that I was had to go to, that I got to on time. Uh, Um, I couldn't physically do it. I broke down in a big mass of snot and tears crying because I felt like everyone was looking at me in the room and stuff like that. So I think the point I'm trying to make is just one little thing can set you off
Yeah.
in a circumstance that you wouldn't necessarily think you're going to have a problem with. So
Yeah.
what
So, what things did you put in place to kind of stop that feeling from happening? Like, what did you do at work to manage that?
I left.
There we are.
I did. I left because I had such a problem with it that I was also having issues at home with the marriage, which, as we both know, ended in divorce, unfortunately.
Mm,
Um, but actually, it all came together at a kind of this mountaintop of I can't
yeah.
cope. So I left work. I ended up having a divorce based on the back of other things as well.
Yeah.
I think I
And
probably
so,
could have
what
dealt with it better.
I beg to differ there.
Mm,
No. And that's, to be compassionate to yourself, like you had this huge wound, this core belief about yourself that as we've established was triggered in that way.
mm,
And it caused you so much upset and so much overwhelm, and you weren't sure where it was coming from or why. And this is what people normally go through is that they think, oh, well, it was just my terrible boss. But normally people should be able to cope with that and maybe push back and be like, hey, that wasn't appropriate. I don't know if you're having a bad day, but that's really not fair on, it was a whatever, an explained situation and have a
mm,
meeting and it goes away. But for people like us that have this open wound, literally, of this, so as you say, when your mum rolled her eyes, all of that stuff used to happen. The
mm,
adrenaline kicked in, you felt nauseous. Still to this day, that happens. And so people go through stuff thinking, oh, it was just a bad job or it was just this, but then they end up with this coping mechanism of leaving jobs every time something happens and they feel like they can't push back. They feel like they can't put boundaries in place. They
hmm.
can't communicate their needs, all of that. And
Yes.
so that is how a core belief that was formed in childhood turns into behaviors and triggers as an adult and then coping mechanisms because of that.
Mm. I do think you're right. I think actually, I shouldn't see it as a bad thing that I chose to leave because I'm at that. Everything has culminated in me being here today. So
Absolutely.
you know,
And we're so lucky to have that.
we're lucky to have each other. So yes, I think that's yeah. Funnily enough, I only just noticed. I only just realised that as we were talking about it. So hmm.
And so, as you said about your motorcycle accident kicking all of this into play and all of this starting to pile down upon you, and it's that it feels like a tower moment in our lives, to
Yes.
use a spiritual description, where everything starts to just break down and everything starts to go wrong. And it's relationships, it's we can't put boundaries in place, we can't talk about our needs, we're emotionally vulnerable. Our parenting is difficult, and all of these things start to really speak of this unprocessed trauma, and we still at this point don't know where it's coming from, but it continues to play out in all of these different ways with medical issues, our focus, our motivation, unhealthy coping mechanisms, and people as well, they're not quite sure what coping mechanisms really are.
Mm,
And that, coping mechanisms can even play out as like excessive exercise, things like that seem healthy and from a well-being point of view. But
hmm.
if you've got anger that's underneath the surface and you're constantly in the gym doing whatever it is and trying to get away from these thoughts, then is the gym actually helping you or is it helping you to cope with that stuff that's going on? Is
Yeah,
it nourishing or not?
I agree because I had a pocket of time where my only focus was exercise, and I got to the point of what I would call lollipop head, which was on the verge of anorexia.
Wow.
I was controlling my intake of food in
Mm,
what I thought at the time was a normal way. I'm getting thinner, I'm getting fitter, I'm getting this, I'm
Hmm.
getting that, but it was my whole focus, and now I understand the fact that it was my whole focus for the
Yeah.
day is a problem.
And it's that word control that
Mm,
you've perfectly said there. And it is, and so many people will that will play out in different ways. And so for some people, it plays out in like OCD ways of control. And it's
mm,
because our brain is trying to process all this stuff and trying to deal with all of these triggers and these emotions going on all the time that we don't know where they're coming from. And it needs some sense of control over our lives.
mm,
So it will do that with things like OCD, like eating disorders and things like that. And I myself was the same as you. And
mm,
it's a when I stopped eating, it was because there was pain in my stomach. And so that was distracting my brain from all of the thoughts and all of the stuff
mm,
onto the pain. And so the pain helped me. It's almost like a self harm thing.
mhm.
And I know there's lots of reasons for eating disorders, but this is one of them in that our brain needs some sort of control or distraction or different focus.
With that in mind, what are your thoughts on, let me just give you a situation. When I was a
Hmm.
child, we lived in a women's refuge, a battered women's refuge for a good few months,
Mm.
if not a couple of years. I can't quite remember the time frame. However, I had horrendous issues with my throat being so swollen on a regular basis that I couldn't physically swallow my own saliva. It was that bad. It was never really dealt with, and I'm not sure whether there was a physical issue behind it or not, but I don't think so. I think that it was more a symptom of my stress at the time.
Yeah.
What are your thoughts on that? Can trauma manifest in physical issues, physical illnesses?
This is my favorite question to answer. And as a medical scientist, it's my like special subject. I love it. Yes, is the answer. Absolutely yes. And this is what happens when you're constantly living in chronic fight or flight, this chronic toxic stress scenario where
Mhm.
you've been through all of this stress and it's all piled in and it's all depressed into your body. And we're holding all of this stuff in. Our nervous system needs to complete a cycle when we go through trauma. And there's a lovely quote from Gabor Mate, who is a trauma doctor. He's incredible. We've all heard of Gabor Mate.
Mhm.
And he says it more eloquently than I do. But, you know, when a child is left, like a child is only damaged by trauma when they are left alone with their trauma. If they're supported and they're encouraged to seek help and talk about it and deal with it, then yes, of course, the trauma was terrible, but they will learn lessons from it and they won't be continue to be damaged from it. Where if they are left with their trauma and they are alone and they haven't processed it, then they end up being in this chronic fight or flight with this toxic level of stress. And so this may end up being a longer answer than you expected. Apologies, but it's so important for people to understand when we are in that chronic fight or flight, our nervous system is going crazy. So it's completely dysregulated. When we go through trauma, we're supposed to have an emotional release following that trauma. So, and that tells our
Ah,
brain that that trauma is in the past. And then our brain can process it and move on. If we don't have that emotional release and support and processing time with our parents or caregivers, whatever, then we remain in that fight or flight response. So that emotional cycle isn't completed. And that will completely dysregulate your nervous system and keep you in this fight or flight mode. Now, how this answers your question is that then that has a knock on effect to our immune system. And our immune system does two things when we have a dysregulated nervous system. Because our brain is trying to identify, well, where is this danger coming from? I'm continually being triggered by this thing. So, like your boss, for example, it's triggering you every day and your brain's trying to look for the danger in the now and it can't find it because this happened 20, 30 years ago. So it can't identify the trauma or the danger. So what it does then is it in simple terms, it talks to your immune system and says, well, it must be something inside my body. And your immune system then starts to look
ah,
around your whole body to try and identify the danger inside. And so your immune system becomes completely dysregulated and overworked and it also cannot do the job that it needs to do on a daily basis, like fighting infection, like looking for cancer, like going around your body and doing all those normal things. So not only is it dysregulated and overwhelmed, I talk about it like, you know, some like one member of staff running a whole giant supermarket. They're trying to do all of these things and serve the customers and stock the shelves and go out the back and all of that stuff. They can't, they physically can't do it. So
mm,
they end up just as a pile on the floor going, well, what's the immediate thing that I need to do? Okay, I'll do that. So
Right.
that's what your immune system does. It looks around your whole body for the most likely cause of what that current danger is. And so if you've currently got a sinus infection or a mild allergy to something, it'll start to attack that and say that must be the problem. So this is where we then start to develop autoimmune conditions from that, so if you have got a digestive problem, it's a bit inflamed when your body decides to do this, it will start to create things like ulcerative colitis and Crohn's and things like that. So for you, it continually would keep starting infections because one of our main first responses from our immune system is an inflammatory response. It tries to just tackle everything at once. And that's what will happen in the first stages of you needing to process trauma. It will tackle everything at once with this inflammatory response. So it raises your temperature, giving you a fever, giving you an infection control response. And so that's why you kept getting those throat infections, because that's what it's trying to do. It's trying to cure whatever this thing is all at once by throwing all the fire at it.
Huh.
But then what happens is if that doesn't work and all of this is still going on, so we're still producing this adrenaline and cortisol from being triggered all the time,
Mm-hmm.
it will then start to look at other things. So I'm going to go out on a limb because I don't actually know the answer to this. What other random physical conditions have you got? Do you have kind of autoimmune things? Do you have
So, the main problem
autoimmune things? That's
yeah,
not.
the main problems I've had, I think, over my life is breathing issues. So I
Hmm.
tend to suffer with breathing issues. And funnily enough, when I moved away from, where I am now, which is I'm back with my mum, when I moved away, I suffered far less with my asthma, almost non-existent for the 20 years I
Hmm.
wasn't here.
You left your mum, your stress levels went down, your
Mhm.
adrenaline and cortisol went down,
Yep.
your nervous system relaxed, your immune system went, huh, maybe we're okay for a minute.
Yep, and then I'm back here and I'm back to I've had probably 2 or 3 lots of steroids since I've been living here because my asthma's back on.
Wow.
Yeah.
Yeah.
So obviously there's an element of pollution because I live near London and my body clearly doesn't get on with that. But
Yeah.
the stress levels
And
have gone through
that's,
the roof and my illnesses
yeah.
have gone through the roof.
And that's how we normally as humans process things. Oh, it must be the pollution. It must be this. It must
Mhm.
be work. It must be that. And so we try and rectify it with those, not excuses, but,
Mm.
ways of, what do you call it? Rationalizing things.
Yes, rationalizing, yeah.
Yeah. And so you go to the doctor and you're like, I have these I'm having all of this stuff. And they're just like, okay, well, you're going through a bit of stress or you've got a chest infection or that's fine. We'll just deal with that. And never do we look at the underlying cause of stuff.
Mm.
And for me, my after I had my child and all of this started going to just everything started shutting down. For me, my immune system chose my nerves instead of my digestive system or my skin or my hair.
Hmm.
It chose my nerves and it
Mm.
started to attack my nerves. And another way of describing your immune system attacking your nerve cells is multiple sclerosis. And I was diagnosed with multiple sclerosis, fibromyalgia, functional neurological disorder, uh, CFS, so ME, all of that. So I had diagnoses as long as my arm, and my whole body just went into complete shutdown. I was bedbound. I couldn't get out of bed. I couldn't do more than one thing a day. And just, I had depression, anxiety. It was awful. And so I'm going
Wow.
to doctors like this unicorn patient going like, all of these things are happening. And they're like, what the hell are you? Like, you just keep coming and you must be a hypochondriac. It must be psychological. You must be
Mm.
stressed. You must be overweight. I remember walking into one neurologist and I was 29. And I was like, look, on the 16th of October 2015, my hands went numb and my feet went numb and they went cold and I couldn't heat them up. I know there is something homeostatically wrong. I know there's something neurologically wrong. And she just went, oh, welcome to being an old lady. And my mouth dropped open and I thought, I'm a 29-year-old woman and I cannot feel my hands and feet and I cannot do anything about it. There's something wrong. And
Yeah.
it took 5 years of me going back and saying, okay, now, and it eventually got to the point where I was like, right, stop this. I need this test and this test and this test. I want a lumbar puncture. I want this. I want that. And what do you think? They all came back positive and they were all gobsmacked. They were like, how you don't, I wasn't presenting like a normal multiple sclerosis patient.
Mhm.
And then there's my toxic father going like, I can't believe you can walk into a doctor's and tell them what you need. You're not a doctor. No, I'm a medical scientist and I have a degree. And this is really difficult for me to say because this is me kind of fighting back a little bit and finding my voice in that I may not be a doctor, but I went to university for 6 years and I
Mm,
studied medical science. And this is something that I love and I know enough about to go into a neurologist and go, I need a lumbar puncture, please.
mm,
And she was like, that's really invasive. That's really terrible. And my father couldn't believe it. And his wife's medical. And she was like, that's really invasive. And you can't do that. And who do you think you are? Who do you think you are was a terrible one.
mhm,
And I was like, yeah, okay, I totally see that. But I still pushed. And I didn't want to see the letter because I was like, what if I'm wrong? What if I'm, if this, I don't know myself well enough. What if
mhm.
I'm wrong? So I didn't open the letter. And my neurologist came to my door. I lived in rural Wales and she came to my door and went, you have to look at this letter. Come on, you need to come in. And that's when all of that started. And still then my father was like, you're making it up and I don't think you're ill and you like being ill. And I mean, it was just the most devastating thing. I digress, but that was the day I cut contact with him because how could you say to your child, you're making up a very serious medical condition? Multiple
Mm,
sclerosis is up there with cancer and all of
mm,
those other things.
yeah.
And how could a parent say that to their child instead of going, oh my God, I'm so sorry. How can I help you?
Yeah, I do.
Nothing.
I do think this is a good point actually to point out to people whilst we're here is that one of the most important things is having faith in yourself and understanding that you know more about your body and your mind than anybody on the outside. And that should be the biggest takeaway from this. That I think that we need people to understand that you're in control. You can change things for yourself and make yourself happier with our help, obviously.
Nice drop there.
Yeah.
But that's such an eloquently, beautifully put sentence. Like, you are the one that knows more about you than anyone else.
Mm,
And if anyone resonates with any of this information, anything like this, random symptoms that are going on, things they can't explain, arthritis things, skin things, digestive issues, all of these multiple things that seem so unrelated, they are
mm,
related.
yes,
They are. And you need to ask yourself if you've been through childhood trauma. And that will nicely take us on to, discussing the adverse childhood event score, which we will have a look at later. But
mm,
we can actually discuss what types of traumas you've been through and what your score is and what you're likely to experience medically based on all of this stuff.
of course. I also want to add that I'm not trying to say that doctors don't know what they're doing here. What I'm saying is
That, yeah,
sometimes that they get bamboozled with all the information. There's so much information out there about what's wrong with people, what could be wrong with people, that it's difficult to know on a personal level without
yeah,
knowing the history, which these days I think doctors don't have like they used to. When I was a kid, our doctor had known me since birth and did until about 20 years of age, but they're so transient now that not everybody knows you as a person.
yeah.
Mm,
And this is a whole different conversation to have for another day, but the doctors have to learn so much and they have to take a general overview of everything, and especially, well, obviously GPs, they're our first port of call in primary care. And they get less than 10 minutes. They're under so much pressure. All they need to do is try and treat what's in front of them right now. And they're
yes,
fighting fire just as much as anything else. And so
exactly.
I'm absolutely not blaming doctors. However, my caveat to that is, having trained in parts of medical school and taught medical students, this isn't something that's talked about even now. And there's a hell of a lot of research on it, and it's there and it's used in medical science and it's used in psychology. It wouldn't take that long for a doctor to say, look, you've got loads of random symptoms. Have you ever been through childhood trauma? What was your childhood like? And just discuss that whilst doing that depression questionnaire,
Hmm.
whilst doing that anxiety questionnaire. They take, some doctors are wonderful and they take half an hour to go through that with you, even when they shouldn't and they can't.
Mm.
And they do, and they're so compassionate and lovely. Why not just do that 10-question survey about childhood trauma? Why not? It
Uh,
would take a minute and a half.
exactly, exactly. I actually it reminds me that in all the years that I've been going to the doctors about the fact that I'm feeling down today, depressed,
Mm.
I'm really not doing very well. I think there's probably only ever been two doctors out of everybody that I've seen that have taken the time to say, wow, you look very unwell. I need to help you here. And one of them sent me initially to a crisis clinic. She said, I need you to go straight to the crisis clinic today because I'm very worried indeed.
Wow.
But actually, one of the biggest problems, I think, as you've mentioned, is the fact that there's no time anymore to just
Yeah.
take time for someone. And so we need to
Yeah.
take time for ourselves to understand that.
Yeah.
we need help here, or we need someone to show us a different way because we don't know where to go now.
Yeah. Yeah,
Mm,
absolutely.
mm,
So, based on that, I suppose if there is any advice that I want anyone to take away from this podcast for me today, this episode today,
mm.
is if you have experienced any sort of trauma in your childhood, please, please, please just go through this questionnaire. And we'll go through this questionnaire now so that it it's only a 10-question survey. It's called the Adverse Childhood Experience Score. And what it tells us is the types of experiences that you had as a child, how likely you are based on the score that you get to experience this toxic stress or fight or flight response, this chronic fight or flight response that then turns into very real, very medical conditions. So we can go through this live if you like and
Yeah,
just go
let's
through
do
these
it.
10 questions and
Mhm.
see what we get. So some of these will be possibly a little bit triggering, and there's a couple of words in here that are a little bit difficult, but just be careful, just to give you a bit of a trigger warning for that.
Okay.
So these 10 questions are: number one, did a parent or other adult in the household often swear at you, insult you, or put you down?
Mhm.
I'm a yes. What about you?
Yes.
Okay, so let's keep our scores on our fingers. All right. So, number two, did a parent or other adult in the household often push, grab, slap, or throw something at you?
Yes.
Yeah, me too. Number three, did an adult or person at least 5 years older than you ever touch or fondle you or have you touch their body in a sexual way? For me, that's an absolute yes.
Mhm.
Number four, did you often feel that no one in your family loved you or thought you were important or special?
Yes.
Yeah. And this is where it starts to get really sad, isn't it? You're like, oh,
Yeah.
when you think about your inner child. Okay, number five, did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you?
Yes.
Yes. And again, you don't need to have all of these happen. If
Just
it's
one
one of
of.
these things
Mhm.
in that question, that's fine. Number six, was a biological parent ever lost to you through divorce, abandonment, or other reason?
Yes.
Yes. Number seven, was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? I just want to add, as a DV trained person, that that also happens to men. So that could be your father or your stepfather.
Mhm. So yes for me.
Yes, for me. Number eight, did you live with anyone who was a problem drinker or alcoholic or who used street drugs?
Yes.
Yes. Yes, me too. Number nine, was a household member depressed or mentally ill, or did a household member ever attempt suicide?
Yes.
Yes.
Big, big yes
Number,
for that one for me.
yeah. Number 10, did a household member ever go to prison?
No, actually. That's the only
Yeah.
one that I don't have any involvement with.
What we've got to think about is that as well, there's multiple answers to these. So yes, there's only 10 questions, but like, and I know this isn't actually in the clinical data, but
Mhm.
you could score more than 10 out of this. You know, there are multiple different facets of these questions. So if anyone's been adding up their score along the way, so I'm a 10, Emma's a 9, and whatever it is for you that's listening at home, these are what those scores mean. So based on these scores, you will have a likelihood of suffering from something called toxic stress, which is basically a fight or flight response, a chronic fight or flight response, which will cause, medical conditions to start developing. As I explained earlier on, with your nervous system and your immune system getting involved, you will
Mhm.
then start to develop all of these random things. So if you have a score of 0 to 3, you are at low risk of toxic stress. And if you haven't experienced any health conditions, so the advice to you would be, just to provide education about adverse childhood experiences and toxic stress and resilience. And then the doctor should assess you for protective factors. If you scored 1 to 3 with associated health conditions, so random things that are on the list that I will talk about in a second, um, then you would be at intermediate risk of suffering toxic stress, and they would give you some advice on how to deal with that, what to do, and they should signpost you into some sort of trauma specialist and dealing with what you need at the moment and giving you a treatment plan. If you scored 4 or above, like we did, the data stops at 4. So it doesn't matter whether you got 4 or whether you got 10, you are at high risk of suffering from toxic stress. And you will start to, and this is with or without associated medical conditions. So it means even if you haven't had associated health conditions, you have got a high risk of suffering from toxic stress. And if you score 4 or above, your doctor should provide you with education about all of this stuff, about the types of things that you can maybe expect to look out for, and what you may develop or what you might be looking at. So they'll give you a full treatment plan, and they should be referring you into a trauma specialist at the very least, or at least someone to speak to, some sort of treatment with regards to some of these medical conditions that could be presenting itself. So on the screen right now, you should be seeing a list of medical conditions, psychological and physical, that you could possibly start developing because of this likelihood of toxic stress. If you're listening at home and you can't see the visual, then it is everything from heart disease, strokes, chronic obstructive pulmonary disease, asthma, diabetes, cancer, arthritis, autoimmune conditions, psychological conditions, suicide, ideation, disturbance, attempts. All of these things is a huge list. And if you are interested in this, please just look up the adverse childhood experience score to see that. We'll have a look at our podcast in as a visual, and you can see that. But this is the type of stuff that we are dealing with on a daily basis when you have experienced childhood trauma. It is so serious and so
Mm.
profound. It makes me so emotional because
Mm.
that's what I have experienced, what you have experienced, and that's
Mhm.
what so many people are experiencing, and they don't even know.
Yeah.
So if you are experiencing or you have experienced these kinds of childhood trauma, and you have medical conditions that you think could be related to this, please go to your doctor and have a conversation that is of a trauma lens, through a trauma lens, where you can say to your doctor, look, I've experienced all of this stuff. I'm getting all of this. I've looked at the adverse childhood event score. I need some trauma help, and I need some treatment with regards to starting to deal with this stuff. And that might
Mm.
be available in your area, it might not be. And we'll talk a little bit about how we can start to like combat all of this stuff in a minute.
I will just wanted to say on the back of that, just to make sure that everybody understands that this podcast is not about blame game. It's not about blaming this person or that person or it's all their fault. This is about learning to look after yourself and fix yourself because no one else has got control of your life except for you. So if you take control and start to learn to give yourself the best opportunity of being as happy as you can going forward, why wouldn't you want that for yourself, right?
Absolutely. It's about empowering people with this information so that they can validate what their body has been through and what
Mm.
their body has dealt with on a daily basis. And like I said, and like you said, you were dealing with this for 50 years and you didn't know. I was dealing with this for 30 years and I didn't know. And
Mm.
it literally caused me to have giant shutdown completely all over my body.
Yeah.
And I couldn't believe it. And even as a medical scientist, I've been in medical science for like 4 or 5 years by this point, and I thought, how stupid am I to not know this stuff? But they don't teach it openly, not
No.
really. And it's just, it, you can't know everything. The doctors can't learn everything. It's no one's fault,
Hmm.
but it does give you such validation as to how much you've been through, and
Mm.
that there is medical data out there that says you might be experiencing these conditions because of everything you went through back then. And
Yes.
that's empowering.
Yes, exactly. Taking control for what we have control over is the best way to go forward, I think.
Yeah.
Okay, so anybody watching, if you went through and did the test with us, the ACE test, the Adverse Childhood Experience test, put your total in the comments if you're happy to do that. Would be interested to see how many that apply to you. So one of the questions I have for you, because I understand how it's affected my relationship with people as I've been growing up and learning how to get past this sort of stuff. But for you in your line of work, what would you say trauma does to relationships, for instance, and people's ability to hold relationships in life, in partners, with their parents, with their children, etc.?
I didn't think this would be such an emotive question, but there is huge emotion there. It's devastating.
Mm.
And so, if this is you, if you've been through this stuff and you got your score, and if you find that relationships are really difficult, you don't trust people, you don't think that their intentions are good, or that they don't really love you, or they're not there for you, or there's something under the surface that they're not quite saying, it's not your fault that you have all of those thoughts and those things, because trauma is devastating. It affects every kind of relationship. Like the family that you grew up in, first of all, and the future that they grow into, all of those wounds will be created, those abandonment wounds, those trust wounds, self-worth wounds, emotional issues, neglect, all of that stuff. Not to mention, if you do have a narcissistic parent or a toxic upbringing in that way, you get all of those behaviors and things play out with all of the different siblings. You've got, the golden child, and you've got the scapegoat and the enmeshed child. And the poor scapegoat is always, the one, bless them, that has probably some substance issues, anxiety, depression, all of those things. And they're just blamed for that. Like, oh, look at how weak they are. Look at how terrible they are. Look at how they
Mm.
ruined their life. No, that came from the toxic narcissistic abuse we had as children. And the golden child tends to like turn into a version of one of their parents. And then the enmeshed child is probably, I think, the worst, where they think they're the golden child, but actually it's all based on it's conditional love.
Mhm.
And only when they achieve things do they get love. But even when they achieve things, they don't get love. And they're always compared to the other ones in the relationship and in the family. So that, and then all of those relationships eventually into adulthood become surface level relationships where no one really talks about anything. You speak to your parent and they're like, how's your job? How's your kid? How's your dog? How's your university going? How's this going? And that
Mhm.
was the kind of relationship I had with my dad. And
Mm.
it was just, he would ask me the same 5 questions every time I spoke to him. That's not a relationship. And I got so upset with, there was nothing deeper than that. We couldn't possibly talk about any emotions, nothing. And we
Mm.
just had this pretend relationship of nothingness.
Mm.
How did that play out for you in your family?
Funnily enough, listening to you talk, actually, it reminds me that I had this conversation with Carlos the other day that I said that I can't seem to have an in-depth conversation with my mum.
Yeah.
She does and says the things that you expect her to. Like, for instance, we let her watch the first podcast and she's like, "Oh my God, you're so clever. This is amazing." Which is great because things are changing. And actually, I'll tell you about a conversation I had with her the other day, which I think you'll be quite proud of me for. Um, but she's the same. I can't seem to have a conversation with her about anything in depth without her
Yeah.
saying the same things. And I'm not sure these days whether it's to do with the fact she doesn't really understand who I am
Yeah.
and how I
That
need.
is such a big thing. They
Mm.
don't know who you are.
No, yep. So that I'm not sure whether it's she doesn't understand who I am and how I need in-depth conversations because my brain works like that on a level that I want to know why
You're a
for everything.
human.
Yeah.
You're a human. You need emotional connection.
Yeah. Or whether it's that she is just not on the same level as me when it comes to thinking about things. And I don't want that to sound like I'm saying I'm more intelligent because I'm not. Everybody has a different kind of intelligence, and some people are more
Mm,
prone to learning about certain things or more capable, I should say. Um, but it's a confusion for me because
yeah.
it leaves me feeling unseen no matter which way I go.
Yeah. Yeah, and it's
Sh-
heartbreaking every
Mm.
time. And it's, again, we can bring that compassion in of what did our parents go through and why are they like that. But again, it seems like they can't go past this level of emotional depth. And when they
Mhm.
do, they panic. And then they push it back to us. And we get those things like, oh, you're a drama queen, you're too much, you're too emotional, you're too sensitive. I'm
Mm.
not. I'm just a human who needs emotional connection.
Yes, yes. I think there's a good saying going around online at the moment, actually. You're not too much of anything. It's just that the people
Mm,
who say that aren't capable of connecting with you on that
so
level.
much that.
Mm.
Yeah. And then there's social relationships. So all our friends, we go one of two ways. We have one or two really close kind of soul family people, and that's it. Or we go the other way and we have loads of friends and it's very surface level and it's like lots of socializing, lots of going on holidays, drinking, all of those things that are very not too much depth. So we either have
Mm.
really good emotional relationships with a couple of people and it's a couple, and or we go the other way and there's no emotional depth and it's just lots and lots of people, and everywhere kind of in between. But we find we start kind of avoiding social situations, or we isolate when something happens that triggers us again, where someone says something and we lose that trust immediately and we panic. We will
Mm.
isolate and we'll shut those people out and we'll say like, oh, they're like this or they're like that. Really, it's our stuff where we've lost that trust and we're expecting them to meet us on a level that they just haven't, or they maybe have their own issues, or they've got their own stuff and they can't meet us on that level. So we immediately back off and we go back to isolation. See, nobody loves me. See, I'm not, all of that. So it's a self perpetuating thing.
Mm.
Um,
One of the biggest things I'm
Yeah.
beginning to realize actually is that the more I understand my own trauma, because that's the word we're using today, is that actually most of the way I react to other people is based in my trauma.
Yeah.
So if you don't have trauma, you can have a decent relationship with people to a certain extent because you're not hiding things. I mean, I think for me, I have a real mistrust issue. I don't trust anybody or anything.
Yeah.
And so I try to control things because my mistrust doesn't allow me to let other people do things for me.
Yeah. And you said there that you're not in a normal relationship without trauma, you're not hiding things. And it's not that people who are traumatized that are hiding things. It's not
Mm.
that. It's that our brain can only predict what's going to happen next based on all the things that have gone before. So it
Yes.
only can predict the future based on the past. So if the past has taught us, okay, if someone dismisses you, then they're going to get angry and violent or whatever, or all of these things are going to happen. That's what comes up in our brain, and that's what we think is going to happen. So
Mm.
that's not our fault, and we're not doing that on purpose. That's what our brain is literally screaming at us. This is going to happen, and you're in danger.
Mm. Actually, I think that's a good point to make for people to really understand is that the things that we do based in the learning from childhood aren't our fault. We just need to
Yeah.
recognize what's happening and find a different way to deal with it. But
Yep.
it's not a blame game here. It's about learning to understand how we can do these things better for ourselves.
Yeah. And don't worry, we absolutely can do that and we can undo all of that stuff. And there is a process and it's
Yes.
fine. But it does take a while. But then again, there's other types of relationships, as you spoke about earlier, your work, there's you don't communicate your needs. You're hyper vigilant for things going wrong all the time.
Mm,
You're looking at all of these things and you're overworked and you are burnt out or you are scared of authority or you don't like authority. There's so
mm,
many things that happen in work relationships too. And that trying to connect with people through maybe talking about other people or gossiping, those kinds of things, or being a victim of gossip and that really affecting us. And oh
mm,
God, I remember at one of my last jobs, there was this one girl and she was just so awful. And she made it her mission to talk about me all the time. It re traumatized me so much to the point that I couldn't even, and I had all of these disability issues going on because of all of this trauma and stuff. And so I had to go to the toilet 10 times a day. Sometimes I couldn't go to the toilet. And so every time I got up from my desk, I'm like, what is she thinking? And it was just re traumatizing me the whole time.
mm.
And she was typing away on Teams and being like, oh my God, Kate, so, and talking about me all the time. And it was just awful. And so
Yeah.
it makes your work environment, your work life so hyper vigilant. And so you're worried about everything and that anxiety hole. And then you end up just quitting. So
Yeah. Yeah. Like I did.
yeah,
So
yeah,
I mean, the point we're trying to make here is trauma can affect all parts of your life, all relationships, work, partner, children, parenting, and that not to be too hard
yeah,
on yourself. Actually, you need to understand that these are a product of past learning, and that we can change
yeah.
that past learning into something else and just overlay it like a hard drive.
That's really good. But the partner one it's the worst.
Mm,
It's the worst because you get trust issues, you start to self-sabotage, like again, if we don't trust that someone's gonna commit to us and love us in the way that we need and whatever, we will start to push them away on purpose so
mm,
that we don't get to that place where we're hurt again or someone leaves us again. If we've got a wound that is an abandonment wound, for example, everyone's going to leave us, no one loves us, you're going to start pushing people away when it starts getting serious. And lots of people have that issue and they can't commit because it's too frightening, too scary, because someone's going to hurt them. And that's what they've learned. The commitment issues and emotional miscommunication and defense and sometimes and there's anxious attachments where you get the anxious avoidant who's got to leave the room and you get the anxious, what's the other one, forgive me, my brain's died, but someone who has to they have to go and connect with the other person and they have to get it out and they have to keep talking about it until I'm that person and my
yeah.
husband's the other, so he wants to leave the room and I follow him around trying to finish
Yeah.
the conversation and it makes him, yeah, you are the
We're
same.
we're
Me
the
too.
opposite here. So Carlos is the no, no, no. We have to deal with it now, and I'm the I want to
Yeah,
shut myself in a cupboard and not talk
yeah,
because I can't process right
yeah,
now.
yeah.
So
And that just leads to really deep issues that remain that we can't, if we don't know why this is happening, then we can't fix it in our relationship. And so we will just either continue in an unhappy relationship and put up with it because that's the kind of communication and love that we're used to, or we just go through relationship after relationship and it doesn't get any better.
What would your thoughts be if I said that one of the biggest things I think we need to learn is forgiveness? And I mean for both ourselves and also for the people perpetrating any kind of neglect or abuse.
That's the million-dollar question, isn't it? And I
Mm.
think I always answer this with, I think there's a difference between forgiveness and compassion.
Mhm.
Um, you and I are very similar people in that we cannot understand people that intentionally do things or have an ulterior motive or like to manipulate people or are aware that they have these behaviors and issues and they just don't want to deal with them. Because things become your responsibility when you become aware of them. And
Mhm.
if you are aware of what you're doing and you don't change it, then it's your fault. And so I think it's I'm able to now have compassion for both my parents, all of my caregivers, all of that, in that they went through a lot of trauma. But I'm sorry, I have spent almost 10 years of my life researching this, understanding it, changing my life. So have you.
Mm.
You have spent so much time and money and therapists and goodness knows what trying to deal with this
Yeah.
stuff. And we've been through hell and back
Mm.
because of those people. And we as parents have decided that we will not allow this to continue. And here's us holding all of this trauma in, trying to hold it back from our kids. And of course, some things are going to slip through the net. And what do we do when they do slip through the net? We punish ourselves and we're so
Yes.
guilty and we want to try and stop that from happening, but we can't stop it all. But we can try and hold on to most of it and change most of it. But there's stuff that's going to come through. But why didn't our parents do that for us? Why didn't they try and deal with their stuff that they went
Mm.
through?
Yeah.
I don't understand that. And
No.
so forgiveness is difficult.
It's difficult for me too, and I get it. Although I have started to look at my mum like a broken child, and in a way forgive her for being unable to give me what I needed. And I think that's released something in me. It's released the anger a little bit, I think, because if I look at her like, well, she's just not capable, and it's never going to happen, and therefore, what else have I got other than forgiving her and moving away from that? But I
Yeah.
also think it's very, very, very important to learn to forgive ourselves for the mistakes we made, because no one gives us a book
Yeah.
on parenting, on getting through depression, on figuring life out in general. And even the schools don't really teach you what you need, how to manage relationships,
No.
how to manage money, how to, they teach you how to think inside a box and be good
Yeah.
in a workplace. So I do think that we need to learn to forgive ourselves more, for sure.
Yeah. And what comes in that healing journey is that compassion for what they went through. And you're able to kind of separate what you have been through and looking at them as, okay, they are a little child too. They've been through
Mm.
this stuff too. And, having compassion for that. Forgiveness is a difficult one. And so, if you're out there at home thinking, I don't think I could ever forgive someone for doing X, Y, and Z, I don't blame you. And
No,
that's okay
no,
too.
too. Yeah, yeah, absolutely. I only think it's worthwhile doing on a personal level because it allows you to release the pain a little bit. Well, it certainly has for
Absolutely.
me anyway,
Yeah.
sure. But if it
There's a
doesn't,
lot of freedom in that.
yeah, but if it doesn't feel right to forgive other people because they've been so mean, or yeah, I think we also need to learn to forgive ourselves for not forgiving others too.
Yeah. Yeah. And, there are some things that people do that are heinous, that are awful, that we, as humans find it very difficult to forgive. And, I would like to think in those situations that I would still be compassionate and that I would forgive and wish them well. And knowing that, they are going to be going through some awful stuff for the rest of their life because of what they did.
Mm.
Um, yeah. And, the most freeing day of my life after my mother died was forgiving her and having a chat with her. And this is running into the realms of spirituality, but having a chat with her and forgiving her for everything that she did to
Mm.
me. There was so much freedom in that and so much peace in that. And and I certainly don't blame my father for all of his things because he's been through awful, horrific traumas, complex traumas, and I get it. And how is me adding the pain of hating him to myself and to him? How is that going to help anyone? I don't see that.
No, exactly. I had, funnily enough, I had the same sort of thing when my dad unfortunately drunk himself to death. As you know, he was an alcoholic. He was a binge drinker, so he'd binge and then he'd be okay for a week or something, and then.
Yeah.
But I chose not to involve my son with his life because he was up and down so much. However, when he passed away and I was in the mortuary or whatever you call it, where, to say the final goodbyes, I hadn't seen him in years, but I felt like I ought to go and say goodbye. And I took my mum with me. She was pretty quiet, and then there was a friend of his that came along who is, and I'm not going to mention her name because in case family members watch, but this person is volatile and what I would call a mouthy human. I
Okay.
don't mean that in a nasty way, but she is. She's one of those with very, very strong opinions and everything. And in the moment of me trying to say goodbye to my dad, she was actually quite nasty about him. She was saying all these horrible things whilst we're standing there and he's laying there. And I actually had to throw her out of the room. I said, if you don't stop, you need to leave because she was being so mean. And I thought in that moment of my forgiveness, I wasn't even allowed that moment of
Yeah.
saying goodbye to my dad and saying, okay, like, I'm so sorry you've been through this and that you felt so awful in life that you had to drink yourself to death effectively at the age of 63 years old. I'm not quite sure where I was going with that, but apart from the fact that I think forgiveness of those that have wronged us when there's no other option is quite a
Yeah.
good way to go because you can't rectify the situation.
Mm.
The only thing you can do is say, I forgive you and let them go, maybe,
Yeah.
you know?
And sometimes that forgiveness can only come after we've released those emotions, after
Mm,
we've been through that process. And,
mm,
because if we harbor that anger or that hatred or that all of those quite right feelings, very valid feelings, if we don't get rid of those and release those, then as we've discussed in this episode, we're just going to continue feeding that cycle and just allowing it to destroy us even further. And,
mm,
I use words like allowing it and holding on to it and whatever. We're not actively doing that. It's not our fault.
mm-mm,
But once you realize the cycle and what's going on, there's a way out of it. And a way out of that is by releasing those emotions. And hopefully, with that comes peace and forgiveness.
mm, yeah. I really hope he's happy where he is now because I think he had quite
Mm.
a sad life, which is a real shame. So, on the back of that, tell me a little bit more about what you understand about fight, flight, freeze, and fawn responses, because obviously they're all symptoms of trauma, and
Yeah.
humans behave differently on a daily basis anyway. But for
Mm.
some people, it's fight, and others it's freeze. And what's the difference, and why would that happen differently for different people?
Everybody is so different, and you can't choose what your response is. Sometimes over a long period of time, you can train it with certain jobs and certain things, but really, this is a biological response that happens to your body that you unconsciously are aware of. So it will happen regardless of what you choose. So, for
Mm,
example, one day my husband and I were driving along, and this poor gentleman was like staggering up these stone steps covered in blood. And he had been drinking and he'd fallen down the steps, bless him, but that's by the by. And I immediately went into rescue mode. I went into action fight mode. That's my response is I will automatically go and do everything and run towards the fire. And I said to my husband, can you please, bless him if he's listening to this, I said, can you please ring an ambulance? And he just looked at me with his phone in his hands and was like, what do you mean? I was like, ring an ambulance. Well, what number do I call? And so for him, he goes into a freeze response. And so
right.
you don't get to choose. And this is why, when we go into certain jobs, like into the army or doctors or, spies, goodness knows what, they choose the people based on these types of neurological responses.
Huh.
Um, so a fight mode is when your fight response becomes activated in that moment of trauma. So your instinct is to cope with that trauma by running towards it, by fighting, by aggression. And so you may be able to relate to that with the anger that bubbles up for you
Hmm.
underneath. But it comes with all those biological responses of an increased heart rate, higher blood pressure, rush of adrenaline, tightened jaw, tightened muscles, all of those things. So we are ready to literally punch the living daylights out of something or do something,
Yep.
And so flight, obviously, the name implies, it triggers the urge to run away, to find safety, to hide, to flee the situation. So for the people that are triggered in that way, and again, all of this can happen being triggered without a trauma if you've been through trauma. So this will happen when you're triggered on a daily basis. So
Mm.
it will look like fidgeting, having trouble sitting still, feeling trapped, or if the room's closing in on you, panic attacks, that kind of panic response, avoiding the perceived or the real threat in front of you. So it's getting yourself away from that situation. You want to isolate, you want to hide. Um, and it can look like, physically leaving those stressful situations, and people don't understand why. So with fight and flight, they are very active stress responses. And so your body feels like it can do something. If it's in the right situation to do that, it will choose to do that.
Mhm.
But whereas freeze and fawn are very different, and they are shutdown modes. They are actually more dangerous than the fight or flight response, because this is where you get, people, when someone is, there's this giant trauma and they're shocked and they die. It's because of this freeze or this fawn response. That's why
Huh.
they're dangerous, because your body wants to shut down everything, conserve energy, and to play dead essentially. And so that freeze response is, if we're thinking about it in an animalistic kind of way, we decrease our heart rate, we dissociate from the reality that's in front of us. There's numbness, we're immobile, we can't move our arms and legs, and we are kind of preparing for death as such, because we're stuck in that position in front of the trauma. And that's where that feeling of, with PTSD and CPTSD, of, to get a diagnosis of that, you need to feel like your life is in danger. And so if you are a freeze or a fawn response, it's very likely that you will feel that actively your life is in danger, and your body gets not tricked into, but it goes into such a state of shutdown that it can actually start to begin to prepare for death in those ways.
Wow.
Um, and so if you are triggered as an adult, with these kinds of with this kind of response, it would look like holding your breath, feeling emotionally numb or confused, having trouble speaking, becoming nonverbal, not being able to take action or make a decision. You lack focus, have trouble concentrating. And that's linked to high levels of anxiety and trauma. And people who've experienced sexual assault tend to go into this response. So I always think of, when I talk about this, of, bless, Mick Carter in EastEnders, his wife.
Yes.
What's his wife's name?
I know
You
Linda.
know who I mean?
L.
Linda
Yeah.
Carter.
Yes.
In her beautiful uh, um, reenactment of sexual assault. It was so beautifully done, in that it normally, you see stuff like that and it's fight and it's all kind of stressful and all of this stuff. She went into complete shutdown mode. And a lot of people will be like, why did I allow that to happen? Why did this go on? Why did I act like that? And some people will even blame someone for acting like that. Why
Mm.
didn't you fight back? Why didn't you do this? We do not get a choice. Our nervous system takes over to protect us from the awful stuff that's in front of us and that's
Mhm.
happening to our body. And so, if that's something that someone listening is identifying with, it's absolutely not your fault that you had that response. You don't get a choice. Your brain decides, not you. It's an unconscious response.
Is it possible that you can experience multiple of these? So, like, for instance, does, as Emma, would I only
Mm.
experience the fight response, or is it possible for me to experience fawn and fire at different parts of my life?
Yes, yes, it is. And it depends on the situation and what's in front of you and how your brain analyzes the danger in that situation. So,
Right.
yeah, for one trauma, you may freeze, and for another trauma, you may actively fight and bulldoze whatever's in front of you, dependent on the threat level and what you think is, your brain thinks is going to happen afterwards.
Okay, so we've gone through a lot today. Um,
A lot.
and I think to finish it off, I'd really like to get across maybe a few pointers. So, for all the different kinds of trauma that people are going through, what sort of what sort of help is out there, and what can we do to help ourselves? Just a brief overview, I guess.
There's lots of things we can do. And first of all, if you've experienced trauma, whether that be childhood trauma or adult trauma, please look for a trauma specialist, someone who is qualified to deal with trauma and understands all of this stuff.
Hmm.
Because for you, normal therapies might not always work. things just like normal counseling or just normal talking therapies, a specialist trauma person is always the way to go.
And if anybody is looking for that sort of service, you can always go over to Katie's website and book her services. So we'll put a link in the comments below and any description. And but she's very good. I obviously have been using Katie's services, so I'm a great advocate. What can we do to help ourselves? I think is a really good pointer. We can start there.
Yeah,
If you can't, for instance, not everyone can afford to get private therapy.
yeah.
So what options are there available for people like that?
It absolutely can be done on your own. It just takes a lot of research, a lot of kind of self-reflection, a lot of time to do that. And sometimes, if you are really at that crisis point or that level of, I really don't know what to do and how to go about healing this stuff, it can be really difficult to start
Mm,
researching the right things and to getting the right content, disseminating what's right for you and putting all that together and then using it and applying it to your life. So I understand that a lot of people, everything is financially difficult right now. I get that.
mm.
But if it is something that you can afford and that you can do, then there are people out there that can do that for you and walk you through that rather than you having to do it alone. But it absolutely can be done. So really, I mean, the first step is really acknowledging, firstly, that you've been through this stuff. So it's doing things like the childhood experience score,
Mhm.
looking at how things have affected you and why, and how it's continued to impact your life. And then we start looking at, really it's these core beliefs, these behaviors, and these coping mechanisms that we've developed because of these traumas. So really, what is affecting you in your life right now? Where are you at? If you're at crisis point and you need immediate medical attention, please go to your doctor. Please get some sort of drug that's going to help you right now to bring you back down to that calm level and access any support that you can and that you need in that moment.
So
But if
something
you're
like
not,
something
go on.
like antidepressant medication and is
Yep,
what you're
yep.
suggesting. Yep. Okay.
And relaxing medication, anti-anxiety medication, those types of things,
Okay.
sleep medication if that's what you need. So it's really looking at your core needs, eating, sleeping, self-care, cleaning, that kind of thing.
Mhm.
If you're not doing those, you're at crisis point and you need
Mhm.
some help. If you are doing those things, but there's just this emotion bubbling up and you're not sure where it's coming from, then that's the time to start addressing this stuff because you can't address it when you are at crisis point. It's too much. You
Yes.
need to come back down to a level of neutrality. Once you're at a level of neutrality and you're taking care of yourself relatively well, then you can start looking at this stuff. So looking at what you went through, what emotions are there because of those things, and what beliefs that have been distorted or damaged because of these traumas. So, if someone left the household when you were little and you've got an abandonment wound because of that, what emotions are under there? What core belief have you got about yourself, whether it be no one loves me, everyone's going to leave me, that kind of thing? It's that type of sentence we're looking for.
Mhm.
That's what you need to change. And that is easily changed, believe it or not. And we are able to, and this is where what I call trauma release. This is where I've kind of developed a process to do this with my clients, in that it does involve inner child work. And so by looking at your inner child as a person, it helps you to separate your experience from your now. So you can talk to your subconscious mind effectively
Mm.
with your conscious mind that is your adult self now. And you can have a conversation with that person and look at them as a child, which gives you empathy, connection, and allows you to release all of that stuff.
Mm.
So in the trauma release that I do, it's based in inner child work. There's a lovely kind of spiritual part of it where we go through and do an energetic realignment and things and get you back in your body, make you feel safe and all of that stuff. But we literally go into a space and we talk to your inner child and we talk to them about this core belief. Remember that sentence we talked about, I feel like this, or I am this, and then allowing the inner child to, you effectively reparent your inner child. And so, like if your child came home from school and said, oh, this happened, and you get them to tell them you everything about what went on and what they went through and what the experience was like for them. Once they've got it all out, they then cry, they
Mm.
release that emotion. And as we talked about earlier, that cycle of emotions that your nervous system needs to complete to put that trauma in the past so that your brain can then process it. That's what we need to do. And
Mm,
that's done by validation, validating those experiences and those feelings, what should have happened, what shouldn't have happened, what you did well, what you were incredible at, what we'll do next time, and what I'm going to do for you as the adult. I'm going to now take care of you. I'm in charge now. I'm your parent. I'm going to make sure you're safe. And you show them everything that about your life that is safe and that you've achieved and that you've done all these incredible things. You basically reparent your inner child based
mm,
on this core belief. And when that emotions come out, and you've told them what the new belief is, which is the opposite of the distorted core belief. So everyone's going to leave me is what it was. I love you. I'm here for you. I'm in charge now,
mm,
reassuring them of that. And then once you've done that, that's when things like affirmations work. That's when you can use those things over and over again. Every time you're triggered, every time it comes up, deep breathing, putting your hands on your chest, activating your nervous system, your parasympathetic nervous system, allowing yourself to be safe in that moment, reassuring yourself and putting that affirmation back in. You are safe. You are loved. I am here for you. I'm protecting you, and you become the parent for yourself. And then you can start putting all those lovely things in that are going to help your mental health. And if you are, if you're having flashbacks, those kinds of things, and you're having nightmares, that means your brain needs to process this stuff and it needs to file it away. So things like EMDR, EFT are great for that. But then once we've done all of that processing, we can then start to put all the good things in, like meditation, like yoga, like different forms of holistic therapy, breath work. Journaling is a great way to do that on your own. If you want to do that trauma release process on your own,
mhm,
journaling through that, finding those core beliefs and helping all of that emotion to come out.
mm,
Acupuncture, energetic work, walking in nature, you know, cold water, swimming, bath, things like that are going to activate your nervous system and bring it back down to that regulated level. All of those things, CBT, NLP, all of these things that are, actively helping trauma therapy,
mm.
or trauma processing, exercise, spirituality in general. Spirituality is so wonderful for knowing that we need to kind of work on this old stuff that no longer serves us and getting rid of that. And
Mm,
a lot of people call that shadow work and journaling, but it's really working on those things that no longer serve us and that is that kind of behind everything else. And um, all of that stuff, learning about narcissistic and toxic upbringings, how it impacted you. It's a wonderful book by a really kind of big TikTok creator at the moment, called You're Not the Problem. It's written by Helen Villiers and Katie McKenna.
I've heard Helen
Incredibly good
Villiers.
book.
Yeah.
Yeah, it's a really good book, really easy to read. It's not technical in any way. It's a brilliant book for learning about narcissistic relationships and
Mm,
how it will have impacted you, the symptoms it would have left you with,
mm.
and then learning about the impact that all of this has had on your body. If this hasn't been enough information,
Yeah, yeah.
there's a great book for that. It's called The Body Keeps the Score by Bessel van der Kolk. Amazing book. He's an amazing trauma specialist. Talking with friends and family, socializing, getting back out there, putting all of these good things into your life that you haven't had because you've been dealing with all of this stuff and you've been isolating and you've been in a depressive state and all of that. And all of the self care, all of the self love, anything that's going to feed back into that inner child, making them feel safe, loved, seen, heard, creating art, music, dance, all of those things. Just beautiful stuff that interests you and that makes you feel loved.
I want to suggest here that we're not suggesting you have to do all of those things because everybody's very different. So
Yes.
I think what Katie's suggesting here is that we need to pick the ones that work for us. Me specifically, when I was trying to figure out what was going on with me, is this is a very good example actually. Is Carlos really likes breath work,
Hmm.
and for me, with my asthma and when I'm stressed and my asthma's bad, breath work is very difficult for me to do. Whereas he's
Yeah.
saying, "Well, yeah, but this is really great for me. You really ought to try." And I'm like, "I do try, but I can't hold my breath because I'm getting, stressed out." So,
Yeah.
so for me, meditation works better because it takes time for me to process a bit of peaceful time, and then I can get into the
Yeah.
meditation session, and then after that, quite often I can do the breath work. So it
Yeah.
really is about finding what works for you. And we're not suggesting you have to do all of these things. And if you don't, you're rubbish or anything. It's choose what works for you, find your level, and then and move forward and try some other things when you feel capable.
Absolutely. And it's a step by step process. And
For
whatever
sure.
feels right for you at the time, do that.
Mhm.
And I also know that, inner child work does sound a bit fluffy, but when you really get into it, it's one of the most powerful things you can do because
Mm.
that child went through all of this stuff. They were never allowed to talk about it. They were never allowed to say the things. They were never allowed to get angry and say, I hate you. And why did you do this to me? And all of those things. They have to be heard and
Mm.
they have to be validated. And what that does neurologically is it moves the memories and the experiences and the trauma itself from one place in the brain to a different place once you validate it. And it allows your brain to then process and file that information and stop it from affecting you anymore. It drops you out of fight or flight. Validation is the biggest part of trauma processing
Mm.
that you can do. And we get that through inner child work.
Yes, I agree. I must admit, I used to think, "Oh, what a load of old rubbish," and actually, after
Me
going
too,
yeah,
believe it or not.
and after going through the experience, now I understand. It gives you a visual reference as to, okay, I can deal with this, and I can help this young person, myself, from when I was younger,
Yeah,
through this experience on a visual level. For me, in my head, it's how it works for me. Where I can hold her hand and say, "It's okay. I've got you now. It doesn't matter. You don't need anybody else. We have
yeah,
us."
yeah. And in the beginning, when you're doing that work, and after you've done that work and you're using these affirmations, it's going to feel like you're pretending
Mm.
or that you're forcing it to happen. But what we're trying to do is teach our brain that this new truth is now
Mm.
true. That old belief is wrong, and this new belief is now true. And so
Yes.
you have to force your brain to learn that. And you can only learn that by providing all of those safe spaces and all of those safe experiences for your brain to go, now I trust that this is true.
Mhm.
Now I trust we're safe, and it will take the over and over again of you reaffirming to your brain, we are safe, we are loved, we are happy, we are peaceful, whatever
Yes.
it is. And that then one day it will come up and it just won't bother you. It won't elicit those responses. And then you'll cry because you've done the work and you're like, oh my God, it worked and I did it. And then you
Yep.
bawl your eyes out. But it's so powerful, so powerful.
I
The
would
brain is an incredible organ.
I agree. I'd liken it actually to going to the gym and doing physical exercise where your muscles
Mm,
grow over time. And I think
hmm
with therapy or soul guidance, that your brain relearns over time. You can't expect one therapy session to fix you. It doesn't work like that.
Yeah,
It's about retraining your brain like you would your muscles in your body.
yeah.
Um, this is a big one for me.
Mm,
What do you suggest to people when they're in the moment of panic or
yeah,
stress? Because for me, I understand that when I'm in that moment, I'm not thinking clearly, I'm not thinking straight. And there has been times when poor Carlos, bless him, has had to pin me on the bed until the anger subsides and he can talk to me because I've had at least two pockets in life where it's been so um the experience in my head was so violent that I
mm,
actually don't remember half of what was going on at the time. It's like a blank for me.
yeah.
So, when people are lost in a moment of stress or anxiety, what would be your recommendation, if any, for trying to help that subside? Something that you can do in that immediate moment.
Yeah. Yeah, and in contrast to your response, for me, I would want to hurt myself. Like if I was like
Mm.
this, this bottle, I'm holding a water cup, and
Mhm.
it's exactly like this that I had, and I had a complete dysregulation moment, and I
Mhm.
smashed it in my face because
Oh my
the only
goodness.
thing I could do was cause pain to stop the process that was happening.
Uh huh.
And for me, that was a response and that's why people do self-harm because they're trying to control that.
Yes.
So when we're in those moments, it really depends on what it looks like for each individual. But for you, for example, in that anger moment, it would be trying to deep breathe as much as possible. If that's not working, maybe even get that physical stuff out, punching a pillow, screaming into something, allowing your body to really feel that. And
Mhm.
then the deep breathing, and then bringing yourself back to a state of regulation. In panic attacks, sometimes I actually had one on TikTok live once, and it was a really good way of like showing how to process out of it because talking to the people in front of me in the room
Mhm.
helped me to regulate. um, so if you dissociate, if you go numb, if you can't talk, it looks different for everybody, but it's trying to bring yourself back into your body and assure yourself that you're safe. So yeah, if you go numb, if you get loads of pain, if you get really like tight and anxious, it's doing that kind of deep muscle massage, deep breathing, really. And it's about the people around you as well, and them understanding what you go through and
Mm,
having conversations in your family about that and what they can do to help you. Do you need them to leave? Do you need them to comfort you? Do you need them to hold you really tight? Do you need them to just get you a blanket and whatever? And all of these things. So it's really looking at your needs in the moment and
mm,
how what you need from that. So it really depends on what symptoms you present in that fight, flight, freeze, or fawn response, um, and how, and literally doing the opposite of those things, and finding what works for you. It's a process. But
mm,
again, you will be in pain afterwards. Adrenaline and cortisol causes all of this pain. You'll get immediate headaches. You'll be, once you've had that, you have to have that emotional release, get that emotion out. You're going to be starving afterwards. You're going to be tired afterwards. You absolutely need to take the day off work if that happens.
mm.
Really giving yourself that self-care afterwards in whatever way it looks for you.
Exhaustion is my thing. What
Yeah,
happens is when I get to that really emotional dysregulation state, as we call it, the inability to control my feelings afterwards, I just that's it. I crash and I need to
yeah,
sleep for 2 or 3 hours or
yeah,
something. So I think, yeah, you need to take time to recognize what your body needs in that moment and
yeah,
give it that for sure.
yeah.
Have you got anything you want to end with? What would be your parting statement for this podcast, do you think?
Before you said that, I was thinking about those moments that I was on the bathroom floor in complete shutdown, not knowing where to go, what to do, how to deal with this, and that everything seems so huge.
Mm,
um, those moments are going to happen, and that's okay. And it's having compassion for yourself in those moments and knowing that there is a way out of this, there is a process, and there are people out there that can help you. Getting support in any way, shape, or form, whatever that looks like for you, is the best thing to do.
mm,
And just, I know it's going to be painful facing some of this stuff, but it's going to be more painful if we don't. And our body will just, it will not be able to cope at some point, and it will just tell you that
mm.
that's what it needs. And that's when we get into those states of really severe depression, real big shutdowns, kind of emotional breaks, mental breaks. And so we've got to be really careful with ourselves and really try and traverse a way out of this together. And it takes a village. You are not on your own.
Yes, exactly. That's a really good place to end, actually. You're not on your own. That's why we're here. That's why we're doing this podcast. If I can come from a place of needing immediate critical mental care from my doctor, where I was sent to a health crisis unit, to being here doing a podcast with Katie and you and still smiling, anyone can get through it. It's just finding the right way for you. So, with that, then, I shall say it's been amazing talking to you as always. And I'll see you Friday
Thank you
for our
so much.
normal session because we've got one
Yeah,
more left, I think. So,
yeah,
and then I'll be fully fledged and
amazing.
perfect. Yeah,
Yeah.
I wasn't about that, yeah. Oi, she, Katie said the same thing. She went, "Ah." Okay, so thanks for that, Katie. It's been informative and lovely chatting with you as always. And we really hope that you guys have enjoyed this. If you have, please consider following the channel, subscribing, depending on where you're seeing us, TikTok or YouTube or any of the other channels. And also, if you feel like you've got value from this, maybe share it with people that you know that are suffering the same problems that you are, or that just need a little bit of help or a little bit of support. Because as we go forward, we are going to give you some options for helping yourself, but we're also taking the channel down a route of all of the profit is going to be fed in to try and help those that are not in a position to help themselves. So if you can't afford therapy, etc. And once we start making profit, all of that profit is going to be put back into the system to try and help those that don't have that option. Also, remember on a daily basis, take a moment for yourself to understand that you need to look after you first, because without looking after you first, you're going to have nothing left to help look after other people. So, for those of you that are a bit like me and that have always been people pleasing or trying to make everybody else happy, you need to understand that you need to be happy too, and you're in control of that. And we can help you to see a different way. Yeah, so with that in mind, remember love, peace, unity, and community always. Without those things, it's very difficult to have a happy life. And we look forward to seeing you on the next one. See you next time.